Depression is the leading cause of disability worldwide, affecting nearly 10% of adults in the United States alone. Unlike a physical condition such as high cholesterol, depression can be harder to grasp because it's a mental health issue. One common confusion is distinguishing between feeling depressed and having clinical depression. Nearly everyone experiences moments of sadness, like getting a poor grade, losing a job, or having an argument. Sometimes, sadness can even come without any obvious cause. Typically, these feelings pass once circumstances improve. Clinical depression, however, is a serious medical condition. It doesn't just disappear because you wish it would. It persists for at least 2 weeks and significantly impacts daily life, affecting work, relationships, and overall enjoyment of life. Symptoms of clinical depression can vary widely and include a persistently low mood, loss of interest in activities once enjoyed, changes in appetite, feelings of worthlessness or guilt, sleep disturbances either too much or too little, trouble concentrating, feeling either restless or sluggish, lack of energy, or recurring thoughts of suicide. According to psychiatric guidelines, if you experience at least 5 of these symptoms, you may be diagnosed with depression. This condition is not only reflected in behavior, but also shows up in physical changes in the brain. Visible changes include a reduction in the size of the frontal lobes and hippocampus. On a more detailed level, depression can involve disrupted neurotransmitter activity, especially serotonin, norepinephrine, and dopamine. Irregular circadian rhythms, alterations in REM and slow-wave sleep stages, and hormone imbalances like elevated cortisol and irregular thyroid hormones. Despite these findings, scientists don't yet fully understand what causes depression. It appears to result from a complex interplay of genetic and environmental factors. But we lack a precise diagnostic tool to predict its onset. Because depression's effects are not always visible, it can be challenging to identify who might be suffering. According to the National Institute of Mental Health, it takes an average of over 10 years for individuals with mental illness to seek help. Fortunately, there are effective treatments available. Medications and therapy can work together to balance brain chemicals. In severe cases, electroconvulsive therapy, which involves controlled electrical stimulation of the brain, can be highly effective. Newer treatments, such as transcranial magnetic stimulation (TMS), are also showing promise. If you know someone with depression, gently encourage them to explore these options and offer practical support, like finding therapists or preparing questions for doctors. For someone struggling with depression, taking these first steps can feel overwhelming. Reassure them that depression is a medical condition, not a personal failing or weakness, much like asthma or diabetes. It's not something they can simply will away, just as you can't will yourself to heal a broken arm. If you haven't experienced depression yourself, avoid comparing their experience to your own bouts of sadness. Such comparisons can make them feel guilty about their struggles. Open discussions about depression can also be beneficial. Research indicates that asking someone about suicidal thoughts can actually reduce their risk of suicide. Talking openly about mental health helps to reduce stigma and encourages people to seek help. As more individuals pursue treatment, our understanding of depression will continue to grow, leading to improved treatments and support.